Greetings, dears. This is Annette of AnnetteLeonard.com, back again with Chronic Wellness. Thanks for joining me. So, I just got back from Seattle, where I go every 4 or so months to visit with my specialists. Primarily, my specialists are of the lung variety because the lung disease is the most life-threatening of the diseases that I have, and I was referred there for double lung transplantation a couple of years ago. And in the ensuing years, I have also been able to be connected with a rheumatology specialist, which has been really helpful. Antisynthetase syndrome is a rare enough disease that my local rheumatologist just sees me. And so seeing a specialist there who visits with a number of patients with antisynthetase syndrome has been very helpful and enlightening. And today I want to talk to you about immune suppression and immunoglobulin. So I've talked a lot about IVIg on the channel and my adverse reactions to it. But for many, it is, for me included, a life-saving, life-altering, valuable, beneficial therapy. And recently, though, I learned some new things. And I have a chief complaint about how suppressed we keep my immune system. So, review. Those of us with autoimmune diseases, auto being self, immune, our system, our defense system, our body's defenses. So we are fighting ourselves. It is quite a head game when you actually stop and peel that through and think about the fact that your body is misaligned, and instead of fighting external threats, it is fighting yourself. And so those of us with autoimmune diseases get put on immune suppressive drugs. So we tamp down our own body's defenses, which of course affects our body's ability to fight external threats also. And my chief complaint about my current regimen is that I can't fight anything. So I spend any time with anybody other than my wife, and sometimes with my wife, and I get sick. I'm just around anyone, and not even sick people, and I get sick. And I've been complaining of this for the last couple of years, and to no avail. However, if you've been watching my channel, video 250, when I talk about Rituxan and the vaccine, you remember that I recently had my Ig levels tested to see whether or not my body was mounting a defense to COVID after having had 4 vaccines. Spoiler alert, it is not. And when I went to visit with this rheumatological fellow in Seattle, he said, so looking back through your numbers of that blood work that I had done in May, he said, your Ig numbers, your immunoglobulin in your body, which is how we measure your immune system, which is why when one receives IVIg, so intravenous immunoglobulin, or SCIg, subcutaneous immunoglobulin, you are getting the immunoglobulin or the immune system of other people. He said, your Ig is barely above 500. Someone's immunoglobulin in their own body should never be below 600. He was like, are you just getting sick left, right, and center? And I was like, yes, I am. That's what's happening. That's what's been happening. I'm sick to death of it. And I am sick to death of it. And he said, yeah, that should never be happening. And I was like, great. What are we going to do about it? And he was like, we're going to give you just a little injection of IVIg. And I was like, no, we're not going to do that. And he was like, we're not? No, that gives me meningitis. And he was like, right. I read that in your chart. And he was like, okay, well, that's what we do for most people. And I was like, so what are we going to do for me? He said, well, the other alternative is, of course, to lower your immunosuppression. So in my case, that's a variety of things. I'm taking pill form of immune suppression, but the primary way that my immune system is getting clobbered is Rituxan, which is a form of chemotherapy. So I am telling you all this to keep you updated on just another chapter in my journey, but more importantly, I'm telling you this because I am 10 years in to living with autoimmune disease. And I'd never heard of measuring my Ig. I'd never known that there was a threshold below which it should not be falling. And he said, on somebody on as heavy hitting of a drug as Rituxan, like you are, you should be getting this tested every 3 to 4 months. Empowering information for a patient such as myself. And I thought, I am not the only one who needs this information. Better bring this back to you all. So, are you on heavy hitting immunosuppressive drugs? Do you get your immunoglobulin tested regularly? Are you clear that your number is staying above 600? That's what I want to know. So sound off here. If this is news to you, I'd love to know it. If you already knew this, I'd love to know it. If you are already checking in with this with your doc, do you get little injections of Ig? Do you get ways to balance out how to keep your Ig above 600? All these things I want to know. So in the meantime, like or subscribe, send this to anybody who could use the information. And until we're together again, thank you for your time and attention, and be well.